Perfect. So disclaimer, this is informational only. Don't blame me for your drug use. So if you choose to use drugs that are still federally illegal, don't blame it on me. This is your own choice. You're all adults. Also, don't encourage your clients to use federally illegal medicines. And I use the word medicine, so I'm gonna get to it in just a few minutes. Having said that, there really is a big mind shift when it comes to these medicines. What is, some of them are still Schedule 1 drugs, so federally illegal and in the same category as drugs like meth and heroin. We see more acceptance, social acceptance in the medical community, in the therapy community, and a lot of research that shows the efficacy of these medicines and how effective they are for psychotherapy and for healing. So I switched slide. Do you see that? The yellow slide? Okay, excellent. So I asked our community members, the members of the EMDR learning community, to tell me about their level of knowledge on a 0 to 10 scale. How much do you know about psychedelics or psychedelic therapy? There's a lot of information out there, and what I found was really surprising to me, because when you ask a question like that, you get a normal distribution. You get a bell curve. Most people are in the middle. You have like one standard deviation is 64% around the middle. 2 standard deviations is 94%. So you see kind of like that bell curve. And here what we see is interesting. A lot of people on the left who have close to no knowledge about psychedelic-assisted therapy, and we see a peak on the right side. And I know some people had the mistake of just like clicked on the wrong place, and then the system doesn't let you re-click it. And then we see very little in the middle. So I tried to think, why is that? Why do we see that not a normal, or maybe the opposite of normal distribution? And I think we can blame our graduate school. So in graduate school, most of us learned that, medicines like Psilocybin, Ketamine, MDMA, also known as Molly or ecstasy, are drugs that are harmful. So when I worked at a community mental health center, I had to have an intake, and I asked people, did you use heroin, cocaine, LSD, magic mushrooms? They didn't call it psilocybin, and these kind of drugs, and it was all under one category. So we didn't learn about it. We learned about the harmful effect of these medicines in graduate school. And on the right side, and this is me making an assumption here, but I'm thinking that these are the people who tend to gravitate toward alternative treatments. And while it had been an alternative treatment in the past, it's becoming mainstream. And this is gaining traction really quickly. So there's been a lot of integration with other therapeutic modalities. A lot of IFS work is being done with this kind of work. And what is this drawing on my slide? Do you see that like that too? I have no idea how it showed up there. So we see a lot of integration with other therapeutic modalities, but I haven't seen anything published about psychedelic-assisted therapy and EMDR. So I started experimenting with myself, as I like to do. And I developed this method, and I didn't develop a protocol, and I'm not going to develop a protocol, and I'll explain in a little bit why. But there are some things that can make this therapy work better, and that integration of EMDR and psychedelic-assisted therapy better. So I asked you guys, the EMDR Learn community members, to ask me some questions, like what do you want to be answered? So I want to answer some of these questions, and then at the end, I'm also gonna have you ask me more questions directly. So, okay, is reality real? That's a this is a question that we asked ourselves during the month. One of our weekly challenges was the question, is reality real? And I think the answer is that reality real, but it's not really real. So we have this concept that we perceive reality as it is, but because we are, our own self, every one of us is our own self, we are not perceiving reality objectively. So yes, reality is real, but it's never being perceived objectively at least in our normal state of consciousness. So this is a quote by Aldous Huxley, who was a British philosopher who did his own mescaline trip in 1953, and then he wrote the book The Doors of Perception, which I recommend for all of you to read. And Huxley talked about mind at large, and he didn't really explain completely mind at large, but the way I understand mind at large is that we have all this information in our brain. So every experience, think about every experience you've ever had is stored somewhere in your neural networks. But if you had access to all this information all the time, it would not be really conducive to your day-to-day functioning. So what Huxley talked about is the concept of reducing valve. And this is a really important concept, that we all have our reducing valve. We are not seeing reality as it is. We're seeing a very small portion of reality in our conscious state of mind or in our ordinary state of consciousness. And what psychedelics allow us is to get deeper into the subconscious or unconscious, where these memories are stored that are not accessible through normal state of consciousness. So I want to answer a few questions that you had. So Patricia said, my knowledge is 0. So again, I asked you guys to rate on 0 to 10 scale, and I'm interested in the legal or liability aspect. So, hey, Patricia, Shabbat Shalom. And I wanted to talk about 3 medicines, and I'll talk about each one of them. Give you a little background on the medicine and the legal, where it stands legally. There's federally, there's state, and there's also how you can or cannot use it for psychotherapy. So the medicines are psilocybin, also known as mushroom. Psilocybin is a kind of mushroom that is being researched a lot these days. It started, the research started with cancer patients, terminal cancer patients who were, close to death. So the FDA approved some institutions to do research with it. And what they found was really interesting. They found that the anxiety and depression that people experienced was significantly reduced, which led them to do more research with people with anxiety and depression who are not cancer patients, and it's been shown to be very effective. Now, psilocybin is still a Schedule I drug, so federally illegal, but I feel fortunate to live in the state of Colorado, where it's been legalized, and it's also legal in the state of Oregon. And in Colorado, I am allowed to grow psilocybin. I can give it to people. I can give it to my friends. I cannot sell it. And when it comes to psychotherapy, it's it's a gray area. So I know I have some colleagues who do this kind of work with psilocybin. I personally, I don't do it. We have a board now in Colorado that is deciding on how this is all going to work in the context of psychotherapy. So I think in about a year, we'll be able to use psilocybin in conjunction with psychotherapy in our therapy offices, because it's being done a lot in research settings. So that's really shortly about psilocybin. Then there's MDMA, which is the active ingredient in the ecstasy or Molly. And this is also still federally illegal, but I think it is that close to being approved by FDA. It really passed all the phase 3 FDA trials, and it's in the finish line to get approved. The problem with MDMA, as far as I know, last time I checked, is the protocol. So the protocol they used in research settings is 6 to 8 hours with 2 providers, which I think is going to make it only a rich people treatment. If you have to pay for 2 providers, I don't think insurances will pay for that. And I don't know that a lot of people will be able to afford 2 providers. So I hope that things are going to change. And again, while this is still federally illegal, the reason why I'm mentioning these medicines is that it's not going to be federally illegal for much longer. And again, I think the research and the acceptance by the medical and the therapy community is huge. So just to give you an example, and I forget what year, but very recently, I think 2021, in Bessel van der Kolk's trauma conference in Boston, Rick Dublin was a speaker. And Rick Dublin is the guy who started MAPS, which is the Multidisciplinary Association for Psychedelic Studies. And he's been advocating for safe and responsible use of psychedelic for psychotherapy since the 1970s. So basically, since these medicines have been scheduled by the US government to be illegal. So these are the 2 medicines that are still considered illegal, even though, again, there's a lot of research. The research with MDMA is a lot about its efficacy for post-traumatic stress disorder. So it's really close to being approved by the FDA. And then there's ketamine, which is most of my work I'm doing with ketamine, and it's a Schedule 3 drug. So ketamine is considered a dissociative anesthetic. So the FDA approval is for anesthesia, but it's being used off-label for pain treatment and for mental health. So it's a prescribed medicine. This is my ketamine, prescribed by a doctor. So I'm not trying to brag here. I'm just saying it's just wanted to show you this. It's a legitimate medicine that comes in a bottle like your antibiotics. It's I know ketamine traditionally had a bad reputation. It's been used in the 80s as a club drug, like ecstasy. But really, when you start to look at ketamine, it's a very safe drug that's been studied by anesthesiologists, by pain doctors, and in the last few years, it's been used for mental health. Most of the research is on treatment-resistant depression, which is depression that, clients who don't respond to a number of SSRIs or SNRIs and psychotherapy. But in my experience, it can also help people with anxiety. So this is a letter that I got from my liability insurance. I called them and I said, I'm doing ketamine-assisted psychotherapy. what's the deal? I wanted to know if I'm covered. I'm using American Professional Agency and I am covered. They sent me this letter. The nice lady I talked to said, I'll send you a letter that you know that you're good, you're covered. But I would say if you just call your liability insurance before you start doing this work, just so you know that you are covered. And this is from Anja from Germany, I think. Yeah. Anja said that she knows nothing about psychedelics, but in Germany, they're forbidden. And I really like what Anja said about worrying that clients attribute positive outcomes of therapy to the psychedelics and not their own contribution to healing and changes they made. So I think this is a very good point, very valid point, very important point to discuss among ourselves and with our clients, because we are going to very soon have these centers that people can come and consume psychedelics. So we have that, for example, with ketamine, we already have infusion centers. So infusion centers, people go and they get IV ketamine, so into their vein in an infusion form, and then they just sit there and they stare at a wall. And I think this is such a waste of time. I think that while people are getting these medicines, this is an opportunity to do psychotherapy. There's a lot of research about what's going on in the brain. They're in a state of neuroplasticity. And while they're in that state, we want to do the work. This is the opportunity. So there are a lot of correlations. There are a lot of things that are similar between these medicines and EMDR. One is a state of neuroplasticity. There's some correlates in the brain. So there's the deactivation of the default mode network. This is a hub in the brain. It's kind of like a network of networks that connects different networks in the brain, and it really quiets down the sense of I or me, or the whole world is kind of being perceived through my eyes. So people are able to see things more objectively when their default mode network is resting. And I think this is a really, really good time to do EMDR therapy, because this is what we want to achieve. When we're doing EMDR, we want clients to look at their old memories and to become more objective, right? Laurel Purnell says from psychological memory to an objective memory. And this is exactly what these medicines allow. So I think back to Anja's question about clients attribute positive outcome to psychedelics, we have to do it in conjunction. We don't have to, but I think this is the best use of these medicines, to do it in conjunction with psychotherapy. Again, if IFS is your thing, do IFS. I really love EMDR, as you know, those of you who know me know that I can talk about EMDR for hours and days. This is a good time to do EMDR work when clients are in that state. Let's see what else. Okay, Freud's theory. So this is the Ice Bear model. I'm sure that you are familiar with it. So this is cognitive therapy, above the water, right? Like we're cognitive, we're here, we're the prefrontal cortex. And then this is what I, again, conceptualize as EMDR. Like we're going below the level of consciousness, but with psychedelics, we can really, really dig deeper. So if you're thinking about the work of Sandra Paulson, for example, who, by the way, is going to be our speaker in October, Sandra talks about preverbal memories. Again, going back to the concept of mind at large, how do you access these preverbal memories? With psychedelics are really letting people go beyond their defenses, beyond their ordinary state of consciousness, and really access these deep memories that are not accessible through normal state of consciousness. So I think that, again, if we're activating the neural networks in the conscious mind and subconscious and unconscious at the same time, this is a beautiful integration. This really helps our clients to access these memories when that are not accessible in normal state of consciousness. There are a lot of defenses. There's a reason why. You think about your clients who are traumatized. What they're trying to do, or what they do in their day-to-day, is just avoiding these memories. And what EMDR and psychedelics have a lot in common is that whatever comes up, comes up. So we're not trying to run away from anything. We're not trying to get away, as opposed to most therapies, right? When people become dysregulated, the client, just is trying to help them regulate. Of course, we have to keep our clients in the window of tolerance, but we want to go toward the whatever is coming up, even if it's negative, even if it's scary. There's nothing bad about going toward it. We need to go toward it in order to process it. So again, really, really helpful with clients who are defensive, that have a lot of defenses, that are not able to access memories. You get these clients who you work with, and you're asking them to do a float back and nothing comes up. If you're using psychedelics, things will come up for sure. This is also helpful to understand that we're going beyond the cognitive mind. So if you have all these, I have a lot of engineer computer programmers who are very left brain oriented, and this is how they think. When you're doing this work, you're all of a sudden starting to see a different kind of, it's not even thinking, it's understanding. And this understanding is deeper than cognitive understanding, because we're accessing these neural networks that are deep inside the brain, in the subconscious or the unconscious. Insights. So as I mentioned, insights are not limited to cognitions. You see a lot of times people start visualizing. So, part of the psychedelics have different names. In the DSM, they're categorized under hallucinogens, but they're also called entheogens. So they're hallucinogens are causing hallucinations. So people start visualizing things. And I can give you an example from a client that I used to work with a couple of years ago, who started seeing shame as something more concrete, something tangible. And I'm guessing that most of you have seen shame in your clients, which in my opinion is one of the hardest things to work with, because what do you do with shame? It's just the lens through which clients see the world. They see it through their shame, and then all of a sudden the shame got some kind of a tangible form, and really that it really helped shift the client's relationship with the shame. And again, this is something that in a million years, if we kept doing therapy without the psychedelics, she would have never gotten there. And then the insights are profound, but we really need to help our clients make sense of the insights. So the psychedelic work is not limited to only the state in which the clients are under the influence of the medicine, but we really want to do some integration. I'm going to talk in a few minutes about integration and what it looks like, because there are different kinds of integration. There's in-session integration, which is kind of equivalent to what we do in the closure phase, so phase 7 of EMDR, but also we do a follow-up integration session. So insurance, my knowledge is zero. Claudia said my knowledge zero. I'm concerned with billing for insurance purposes. Our insurance is covering psychedelic-assisted therapy. Not to my knowledge. So one thing you want to know is that when you do these kind of sessions, it's at least 3 hours. And most insurances, or I think all insurances, they don't cover 3-hour sessions. So some of my colleagues, I asked Tiffany, who does take insurance, and she said that you can bill one of the sessions. So the first session under insurance, and then the other two have to be out of pocket. But I think these are important things to discuss with your clients before you get into that. And for you to know that you can't do a 50-minute or a 60-minute or even a 90-minute session when you're involving psychedelics. Research, there is tons and tons and tons of research. There's so much new research with brain scanners. A lot of the research is coming from the UK. Robin Carhart-Harris is a big name in the psychedelic world, who's doing fMRI studies with psychedelics and really seeing, he's been talking about the quieting of the default mode network, but there really is a lot of research, which again makes me believe that in the near future we're going to see these medicines in our therapy offices. It's not going to stay kind of like an edgy kind of therapy. It's going to be mainstream because there's a lot of research that shows the efficacy. Again, I can talk a lot about research, but our time is limited. So this is the brain. This is taken from Michael Pollan's. This is taken from Michael Pollan's book, How to Change Your Mind, these two images. And this is a visual simulation of neural networks in the brain in placebo and compared with psilocybin. So basically what you see is two things. First of all, a lot more activity with psilocybin, but what you're also seeing is a lot more connection between or among neural networks that usually don't talk with each other. So neural networks usually talk with the neighboring neural networks. And what we see in psychedelic states is that different networks start talking with, when I say talking, is firing at the same time and wiring. And this leads to all these mystical experiences, spiritual experiences, even for people who are not traditionally spiritual, and all these insights. That what's interesting about these medicines and why I love this work so much is that once the medicine leaves your body and your brain and your system, you still have these insights, as opposed to, for example, SSRIs. You're depressed, take SSRIs. Best case scenario, it's helping you. A lot of times it doesn't help, but let's say it does help you. Stop taking the SSRI and you're depressed again. And there's there's what's called SSRI discontinuation syndrome. So people are really having a hard time getting off of these medications. But with psychedelics, when you're taking a psychedelic and you're getting these insights are staying with you. They're even weeks, months, and years after the psychedelic experience. So I thought, and these images are coming from Robin Carhart-Harris's lab in the UK. So again, integrating the two modalities. I know a lot about psychedelic-assisted regular therapy, but not with EMDR. So in the training, I'm really going into each phase and how it integrates with EMDR. Again, from phase 1 to phase 8, and every phase there are things that we need to think about. And in some phases, we need to do a lot more work. So In phase 2, for example, we have an extended phase 2. We can't just, and some would say that we need to have extended phase 2 anyway with every client, but we're really going in depth into the different phases and how we integrate that. And again, if there are any questions in a few minutes, I'm going to let you ask any questions. How it works. So basically, I start with 3-hour sessions with ketamine, and we're starting on a relatively low dose. So what's considered psycholytic and not psychedelic. So when in psychedelic, there's really people experience what's called ego dissolution. So they're kind of lose sense of self completely. And with psycholytic doses, people still know who they are and they have orientation, but they're slightly disoriented, but they're not completely disoriented. But it really changed their perception of things, of reality, of themselves, and also memory, which again, this is that opportunity to do their reprocessing work. So the way I work is what a session looks like. So I break down a session into 3 segments, and I call them segments and not phases, not to confuse with the phases of EMDR. So we have an extended preparation phase. We set intentions. There's a separate informed consent the clients sign. They have to make sure that they have a ride to and from the session. I give them instructions on what to eat and what to drink, or more, what not to eat and what not to drink, because we don't want to go to the bathroom every 5 minutes in a session. And then they start with a dose. So we're starting with the first segment. They're just doing it as a traditional psychedelic-assisted psychotherapy with music. And I got these 2 speakers that can play bilaterally, and they put eye shades and they lay on a bed. And that would be the first segment. And ketamine really gets into the system really fast, but they also get out of the peak state very quickly. And this is when we do the reprocessing, this is the core of the work, but we also want to do integration. So there's so much that is coming up in these first 2 parts of the session that we don't want to leave the clients to just go with all that ineffable experience, right? The experience they can't put into words. So we're trying to help them make sense of these experiences. This is in-session integration. And we also want to do a follow-up integration session to really help them make sense of what came after. So this is another thing that has that psychedelic-assisted psychotherapy and EMDR have in common, is that a lot is coming up after the session. So in psychedelic psychotherapy or psychedelic EMDR therapy, I'm telling my clients they have to take a whole day off before the session and after. And the after the session is really being used for reflection and journaling and doing art and listening to music and going to nature if they can. But I really don't want them to, go to work after a session, which, again, not really realistic, but some people might want to go and, spend time with friends. I think if they need to have some kind of a plan, if negative material comes up, which sometimes happens, but we want them ideally to reflect on things. I know, for a lot of clients who do EMDR, they do their EMDR session, 15-minute session, and 20 minutes later in front of a computer getting bombarded by emails and all that. This is not happening after these kind of sessions. Clients have to be dedicated to it and take the time off and take the time to reflect, because a lot of stuff is coming up in these kind of sessions. Okay, if you want to learn more, there's so much. I love to read. I read a lot about psychedelic-assisted therapy and psychedelics in general. This is one book that I highly, highly, highly recommend. Michael Pollan is my hero author. He's just, he's a brilliant, the writing is just so beautiful, but also the information. So really, he goes from the history of psychedelics, and there's kind of like we're the third wave, because there's the history of indigenous cultures that have been using these medicines for hundreds of years. And then there's the history that started in the 50s and 60s in the Western world, before psychedelics became illegal medicine or illegal drugs. And now there's a catchphrase that is very common in the psychedelic world, the renaissance of psychedelics, which is happening now. So I think that 2023 is a really exciting time to be a therapist, because these medicines are coming back into the therapy room really, really quickly. And I personally, I find this very, very exciting, because we really have this opportunity not just to help people feel a little better or treat their symptoms, but we really have an opportunity to heal. So this is really, really exciting. I've been experimenting with this myself with my clients, and I'm being transparent with my clients. And I've really been seeing good results. So I put this training together, which is going to be in October. I wanted to make it affordable and accessible. So it's going to be for 4 2-hour sessions on Tuesdays. So it's going to be in October 10th, 17th, 24th, and 31st, between 9 and 11 Mountain Time. So people don't have to really take a whole day off. And I really priced it at a ridiculous price of $200, a little under $200. I will still make it affordable, but it's not like next cohorts are not going to be that affordable. It's the first time I'm teaching it. I'm really excited to share the knowledge with people. I also will have follow-ups at no additional cost. So I didn't post it yet, but November 7th and November 14th, those who are taking the training will have a chance to meet 2 of the doctors that I work with. So my goal is for you, really, for people to take the training, to be able to do this work after the training. I'll give you some resources. I'll introduce you to the doctors I'm working with. So you'll be able to find your own providers who will prescribe these medicines to your clients. We'll go over, basic things like taking blood pressure before the session, informed consent, all these kind of things, and also how to integrate it into EMDR therapy. Now, if there are any questions, I'm ready to answer questions.